Hello, everyone, and thank you for joining us for the second Data for Good webinar. Our first webinar was on highlighting the achievements that the project had chalked. Our hope was that national statistical offices all over the world would consider adopting the Ghana model in their own countries. And so for those who missed it, the very first one, you can find it on Flowminder's YouTube channel. So please check it out. Today's series will be some mini presentations about the work that has been and is being conducted in Ghana. So I will introduce today's speakers. First, we have Omar Seidu, who is the head of demographic statistics and SCGs coordinator at the Ghana Statistical Service. Omar, just give a little wave so that everybody can see who you are. Great. And then we have Kathy Riley, who is the Senior Partnerships Director at the Flowminder Foundation. Hello, Kathy. Now we have David Bessa, who is a data scientist with the Ghana Statistical Service. Hello, David. And we have Victor Owusu, who is a program coordinator, also with the Ghana Statistical Service. Right. Now we have Roman Goldenberg, who is a data scientist and trainer with Flowminder. Hello, Roman. And then last but not least, Tom Smallwood, who is a data scientist with Flowminder. Hello, Tom. Thank you. Before we jump in, please remember, you can share your questions at any time for any of the speakers while they are speaking. And as we did last time, we'll tackle them one by one in the Q&A session at the end. So let's begin today's webinar with a short presentation from Omar. He's going to tell us, he's going to give us a general overview of the partnership and its objectives. Omar, please go ahead.
Thank you very much, Richard. And good afternoon, good morning, good evening, wherever you are joining us from. The Data for Good partnership is the first public-private data sharing partnership in Ghana, which gives meaning to the SDG 17 that talks about partnerships for achieving the SDGs. In this case, bringing together data, technology, and innovation for solving the problems of humanity. The Data for Good partnership was set up in 2018 between the Ghana Statistical Service, Vodafone Ghana, Flowminder Foundation, with financial support from Hewlett Foundation and Vodafone Foundation. The Data for Good partnership was set up basically to fill data gaps and connect data production to use, especially mobility patterns and how these can best be used to support decision making more timely and in more granular forms. So this partnership has been in place over the period, and it has proven to be a good project that brings together the national statistical system, the telecom sector, and the technology firms like Flowminder Foundation to work together to achieve the goals for which this partnership was set up. So we're happy to have you join us, and stay tuned for very exciting presentations from our colleagues. Thank you.
Okay, thank you, Omar, for that insightful overview. Now I'd like to move on to Kathy to enlighten us a little bit about what CDRs are and how the data is processed, with emphasis on data privacy and security. Over to you, Kathy.
Thanks very much, Richard. And thanks everybody for joining today. Core detailed records, what are they? These are records that are created by the mobile network operator, in this case, Vodafone Ghana, during the process of actually billing their customers for their use of the network. In these call detail records is information that's recorded with regard to where a call is routed through in the network, which cell tower, and at what time. And we're able to use that information to identify patterns of mobility in the population between cell towers. So the cell towers are used as a proxy, really, for where people are located. We're not looking at individual GPS locations, so we've got a very strict protection of individual privacy, and we also take a number of other steps to make sure that data protection and privacy preserving methods are used in the analysis of these call detail records. We use the term call in this phrase, but actually we're talking about different types of events on the network. That can be a call, a voice call, an SMS text message, or a data session, or any number of one of those things. So you could be using your phone maybe to send and receive emails. That is routing through the network, and that is also registered in these billing records. The idea that we are embracing here is we're using passively generated large volumes of data that already exist with the mobile network operator, and we're mining them for information that is useful to the development of the country and the production of official statistics, the use of the data in order to support decision-making by the government and other actors in the country for the benefit of the public. I think now we'll move on to hearing a little bit more about how these call detail records can be mined and for what purposes. Thanks.
Thank you, Kathy. So yes, let's talk a little bit about the work that Flowminder, Vodafone Ghana, and GSS were doing. Let's start with the COVID-19 use case. Roman and David, I understand that the collaboration brought about 3 key mobility reports that were really insightful during those times. Could you shed more light on the COVID-19 use case, please?
Okay, so thank you, Richard. So my presentation will focus on the insights. So my presentation will focus on the insights into the effect of mobility restrictions in Ghana during the COVID pandemic era. So next page, please. Thank you. So when COVID hit Ghana in 2020, just like other countries, government imposed restrictions on the movement of people by way of introducing banning public gatherings and then closing down schools and also lockdowns in some places. As per our mandate, GSS was expedient for us to respond to the issue, to assess how people were complying to the directive that government had given. And so we went in to come out with the first report to respond to the initial lockdown. And then moving on, we sought to understand how population movement had changed soon after a lockdown was in place. So in that time, we had schools closed down, and the public gathering was also still in place, but the lockdown had been lifted. So that reflects the second report. And then moving into December 2020 being our election year, it was proper that we also look into what was happening, whether our mobility had recovered to pre-lockdown periods. And so we had to do another report also to reflect what the situation was when schools had resumed. So I take you through what the events were for the analysis. Next page, please. So in March 16th, schools were closed down and then a ban on social gathering. 2 weeks after, 2 of our great cities, Accra and Ashanti, experienced lockdown. And then on the 20th April, the lockdown was lifted. And so moving forward into December, on 7th December, we had elections. And then as the routine was, the government, the president will give an address. And so on the 17th January, there was a presidential address. We wanted to also understand how mobility was recovering, taking into consideration these events. And so on the 18th January, schools had been resumed. And so our three reports, the first one looked at a period from 16th February to March 31st, just to capture what mobility patterns were right after the initial lockdown. And then the second report was to respond to the lockdown when lockdown was lifted. And then the third one was to assess whether we were recovering back to pre-lockdown periods. So I'll hand over to Romain to take us through the next presentation.
Yeah, thank you very much, David. So just before we get into the results, I'll just give a very quick background on what was explained by Cathy, just to give you a sense of what's happening when we are using this data set. So we're talking about call data records, and essentially what we observe on the ground here is represented on the left-hand side of your slide. So this is an ideal representation of a subscriber moving in the landscape with his particular events recorded. So events can be a phone call, a message using mobile, internet, etc. So while this person moves in the landscape and creates events with his phone, those are picked up by local cell towers. And by looking at this trajectory in time, we have a sense of where the person moved at those different periods every time a new event is made, essentially. So this information is recorded by the network operator. Here, the main purpose of this is for billing the user when he is using his mobile phone. So what you end up with essentially is a huge collection of records. So each of those are included in this huge data set. And at minimum, they will include this anonymous subscriber ID, a timestamp, so time of the event, and the ID of the cell tower that received the message or the phone call. So each of the rows you see here correspond to one such event. And thanks to this, we can understand the approximate whereabouts of a subscriber based on the cell tower location. Generally, a CDR dataset will contain billions of points, and from this, we can then study human mobility. And I'll just emphasize again, very importantly, that what we use is metadata, so properties of those events. We do not know anything about the call itself or the content of the message that was exchanged. We just know the property of those events, and those events are anonymized. This is a bulk information properties of the phone events, but we do not track individual, and this information is anonymized. So moving back now to the results from the COVID reports, I'll only show a few examples from those reports. Those are available online, so feel free to consult the full versions. Here I've only picked a few examples just to give you a taste and an idea of the mobility patterns we've observed. So if you look at the graph here on the left-hand side, you can see that the number one here corresponds to the initial restriction nationwide. So start on school closure, ban on public gathering. Number two here is the start of the lockdown period. So for Greater Accra metropolitan area and the Greater Kumasi metropolitan area. 3 signals the end of this lockdown period. 4 is the election period. And 5 is the presidential address. And the figures you see here is the number of trips between districts in Greater Accra. So we look at the Greater Accra region, and we look at internal mobility inside this region. Those values represent the relative compared to the baseline box here, which is our reference period. So we look at the movements between districts compared to this reference period. And so this gives us a sense of the mobility in a normal situation and the impact of the lockdown here. So in a nutshell, what we've seen is an initial 20 to 30% decrease when initial restrictions were put in place, followed by a much larger decrease in mobility during the lockdown period. As you can see, after this lockdown period, the mobility started to slowly recover, but there was still a timeline, longer time period for this to go back to normal and reach back to similar to pre-lockdown period level around February 2020. Quickly on this, we've looked at the internal mobility in Greater Accra, but you can see similar patterns when you're looking at the mobility outside of the region. So looking at the connection with other regions from Greater Accra, you can also see similar types of pattern with huge decrease during the lockdown and starting decrease in the initial restrictions. There will be, of course, several variations depending on the typical region or the specific region connected to Greater Accra. But on average, the pattern is also observed outside of the region. Finally, what we've seen in Greater Accra also applies into other regions. So this figure looks again here at internal mobility in each region. So you will see a decrease occurring during the first lockdown period. Similar patterns. Generally a decrease during this period, but there will be, of course, varying timings on these mobility patterns, varying amount of the decrease in mobility, and changes in the exact recovery period. What you can see from this figure, generally the striking image is that all of them decreased though during the period. So in a nutshell, taking all of these results together, and again, I invite you to consult the reports if you want to know more about specifics of it. We observed the first decrease during the lockdown period, a recovery that will be dependent on the region you're looking at from approximately June to December 2020. When we think about the presidential address, there's possibly been a small decrease in response to this. And by April 2021, we can observe that at least half of the regions in Ghana reached similar levels of mobility as previously from the COVID lockdown. So I'll just give you the presentation back, David.
Thank you, Romain. So I just taking a glimpse from some of the findings. We want to conclude that a sharp decline in the mobility observed following the introduction of partial lockdown and travel restrictions was likely to have slowed the rate of COVID infection in the country. Also, as Romain indicated, half of the regions in Ghana, there was full recovery of mobility patterns after the initial lockdown. However, in Ashanti region, there were still low seasonal footfalls and they're potentially missing the economic opportunities. Again, we also realized that travel patterns returning to normal highlighted how critical vaccine rollout and adherence to COVID-19 protocols were. So I would want to end my presentation with a quote from the Vice President of Ghana, who said, by looking at how the number of active users change, we could see how effective lockdowns were in restricting people's movement. This was vital in telling us when to lift and when to renew measures. Thank you.
Thank you very much, David and Romain. Let's talk a little now about routine mobility analysis. This is about how the regular patterns, the movement patterns of people can help in various planning and strategic decisions. So Romain and David, you still have the floor.
Okay, so thanks again, Richard. GSS realizing the need for population estimates, in informing social interventions, and if you like, addressing humanitarian issues. We have set up a standard mobility, develop a standard mobility report to biannually, release data on population estimates, with special highlights on next. A special highlight on providing geographical distribution of population and its variation. And also the report would also investigate whether more people are traveling, if you like, to Accra during the weekends and during the week to compare. Also to understand where people are coming from. The standard mobility report will also help us to know unusual trends across different time periods. And in that, we will be able to compare with other years. Apart from these standard population estimates that will be churning out, the report will be able to also inform, the activities of NADMO, disaster management, and also address health-related interventions. So just to take us through how we got here. This has been a long-standing partnership we had with Vodafone and Flowminder, with technical assistance from Flowminder, giving GSS the capacity to be able to access Vodafone's data, mobile phone, de-identified, let me emphasize this, de-identified mobile phone records, by giving us capacity in Python programming language and data analysis, and also be able to run the standard mobility codes and generate reports. The codes that have been written, it has been done with respect to ensuring that data privacy issues are not breached. I think we heard in Kathy's presentation how important it is to ensure that the security of data processing is adhered to. And so what we are doing is to make sure that the confidentiality clause as the institution ensures that it's adhered to in its operations is actually in place. So information that is collected, any information we are getting from the codes is generating, these are numbers and not, as it was mentioned earlier, individual records. Before reports are generated, it goes through phases of review, it has to go to Vodafone. It needs to be approved by a steering committee. And then also to ensure continuity of the project. Capacity has been developed with GSS to be able to access the data, and also ensure the regular production of mobility indicators are done. So I'll give it over to Romain to give us insight in some of the findings from the standard mobility report. Thank you.
Yeah, thank you, David. As for the COVID presentation, I'll just give you a little taste of the things that will be available in the standard mobility report. I've done a small selection, and from those, I'll be focusing first on long-term mobility and second in short-term mobility. So some example of the products visualization, mobility analytics we can produce are presented in front of you here. Those particular figures are focusing on the period 2020 to 2022. And on the left-hand side, you can see our measurement of population trends per district in the whole country. So what does this mean? So essentially, using mobility, we can have a sense of the migratory balance in each district, people moving in, people moving out. This measurement is long-term because essentially we see where people are located and where they live and where they might move. And based on that, we can calculate this migratory balance and have the sense in the change in the population on a monthly basis. Using all of this monthly data then gives us an idea of the trend over a longer time period. So as I said, 2020 to 2022. And that's the different colors you can see there. So district highlighted in blue are places where we see a decrease in population, and in red an increase in population there. So based really on this migratory movements of people. We also indicate if these trends are fluctuating or constant in time, essentially having an idea of whether or not a change in population is constant through time, or if during a certain month you have a certain peak or huge decrease that will be tied to, say, seasonal events or particular at one point in time events. So this is, of course, very useful because you can see this population at a small scale, really locally across the whole country. And it can also lead you to further insights into the understanding as to why this is happening. Why do you see these trends in the country? On the right-hand side, you have an example of those relocation I was just talking about. So we use this relocation to have a sense of the migratory balance in the place, but with that, we can also map this connection between places. So here I'm showing you an example of the largest relocation at the region scale across the whole country. And this one gives you an idea of the largest relocation flow between the regions. So really the ones that are the most important, the most, the biggest migratory flow of people relocating. This is only one map. As I said, there is much more in the report. And here I'm showing you the large view picture of this migratory flow. But once you get a sense of what this tells you, we can, of course, use it to focus on specific areas. And this is what we do in the report. So looking at particular cities or districts of interest and trying to look at the migratory flow from these places to all the other places to get a sense of people movement on the long term. In terms of short-term mobility here, I've used two other examples. So on the left-hand side, you can see the daily travels with Greater Accra. So what this means is we use the daily movement patterns of people to get a sense of the connection between each district and an area of interest, and the area of interest being here Greater Accra. So we can then map out the connection between all of these districts and Greater Accra, and this gives us a sense of the special connectivity of this particular place with all of these other districts. So we have a sense of the connection between these places and on the magnitude of this daily travel mobility connection between these places. So you can start getting a sense of where you have the most, the least amount of people traveling from and to in this situation. And based on that, so you have a spatial representation of this daily connection, but you can also look at the time series. And in this particular figure, I'm showing the changes in travel counts, again, between Greater Accra and all the other districts in the country. And this gives us a sense of the mobility through time. This is a little bit similar to the plots you've seen for the COVID presentation. And similarly, from here, there is a lot of information we can start to understand or extract. You can have a sense of the size of the mobility during a particular day, the fluctuation in time, the grouping. If you're interested in particular days, say weekdays, Saturdays, Sundays, you can have a sense of those by looking at these timelines. You can also observe certain tendency. Here you can again see the impact of COVID-19 during the 2020 to 21 period, this huge dip, and look at specific days which potentially might have abnormal values. Some days have really out of the normal mobility values. So you can really pinpoint them and try to understand why this is happening in this situation. So again, this is really trying to give you a taste of those things. Much more that is available in the report. And going forward from there, so our objectives currently is to produce 2 first mobility reports. So one that will be based on the period I've just shown you now, that we can call historical from 2020 to 2022. A little bit establishing the situation at the time over a longer time period. And the second report focusing on the smaller time periods and a more recent one. So an example could be first semester 2023. So this will of course include good figures and much more with a summary of the observation. And from there, ensure an efficient and timely production of those. Efficient and timely meaning most of the code is ready for that. So we want to minimize the efforts required to produce these reports. We want this information to be delivered regularly. And each of those reports being, specific about the time periods and being able to look backwards and compare mobility to previous reports and having this capacity and knowledge in country at GSS. And of course, along the way, including future feedback or methodology improvements. I think I'm giving back the talk to you, David, right? Or do you want me to present?
I thought this is your portion.
Okay, I'll present this quickly. So the provided knowledge I've just shown you here is quite general. Obviously, I'm trying to give you a sense of the work we do, but each report will be tailored to a specific time period. So we'll of course provide much more specific insights. But in general, if we were to describe the knowledge provided by this report, you get a sense of the population trends in the country, increases, decreases at a local level. You can monitor and understand routine mobility, whether on the long or the short term, potentially understand the impacts of specific events, and compare between different time periods once this regular production is occurring. And finally, that's another important point, and that is even more relevant going into the other presentation, which will serve as the basis for more in-depth investigation and for a specialized application that will be discussed very soon. Okay, back to you, David.
Yeah, so in terms of potential uses or use cases for the standard mobility report, we believe that this can inform, optimal provision of social amenities. I mean, if you know that a particular area is receiving an inflow, much inflow, then the population is likely to increase. And so there will be the need for government to look at this data and then make some provision of some social amenities. Again, in terms of traffic management, we think that you can also use the mobility report to give you, some heads up on, if you like, introducing, nightlife in the capital cities, particularly when it is in the festive season. We think that, for instance, the metropolitan areas, we know that a lot of people move to the metropolis. If the information you are getting during the festive seasons, there's a spike, then that can inform, government as to having some ad hoc intervention in terms of bringing marketplace too closer to people, as you may have attributed the movement of people during festive season to shopping. And so again, in terms of humanitarian interventions, we think that this is a useful information to support that. For instance, if Ghana Health Service or NADMO is embarking on vaccination, Ghana Health Service is embarking on vaccination or immunization program, the mobility report can give indication of where people are and therefore inform the logistics, optimal supply of logistics. Again, addressing sanitation problems in the country, the metropolitan, municipal and district assemblies can use the mobility report to, if you like, provide some bins or provide some dumping sites where they can go and lift the refuse. In that case, making Accra and other places a better place to live. Thank you.
Thank you very much, David and Romain. You spoke a little bit about the next use case I'd like us to focus on, which is health. But I'd like us to have Tom and Victor talk about how CDRs have been useful in health-related decision-making. Tom and Victor, over to you, please.
Thank you very much, Richard. Good morning, good afternoon, good evening, wherever you might find yourself. So for the past 15 years, Ghana has chalked a lot of success in our public health system and in the area of maternal health, infant and neonatal health, immunization coverage. This presentation looks at how we can incorporate mobility report into public health metrics in Ghana. Next. To improve on our public health system, as a country, there's a need for us to have accurate information that will lead us into more of having informed decision-making, which will help us to choose one suitable spatial and temporal resolution, and in terms of also calculating monthly at the district level when it comes to mobility reports. This will improve our health system. On the metrics that we have, the mobility report, if incorporated, will help our monthly population estimates in health indicators or metrics to support the improvement of public health system in Ghana. These health metrics or indicators are related to the spatial resolutions and its calculation, especially in the case of diseases cases. As an example of incidents of hypertensive cases in Ghana per 1,000 population. In all this, population in areas changes over time, and therefore there's a need for us to incorporate this mobility report. Next. In June 2023, Flowminder with Ghana Statistical Service had a key stakeholders meeting as a workshop in the use of mobility data for public health. And in these, key implementers of public health policies were involved, that Ghana Health Service, Ministry of Health, and public health system students of the University of Ghana who were in support of this program, and it was sponsored by Flowminder. 4 key priorities areas came out of this workshop, which includes 4 of the following as shown on the slide: tuberculosis incidents and outpatient department attendance, antenatal care coverage, and hypertensive incidents. Next slide, my colleague Tom will take over.
Thank you, Victor. So starting with just thinking a bit about the underpinnings of why mobility data is important for public health metrics. So looking here at this slide, we can see an example here of 2 districts, District A and District B. And in the first month, each district has a population of 20 people, and District A has 4 cases of a condition, and District B has 8 cases. And from this, we can calculate that in each district, we have a prevalence of 0.2 and 0.4 respectively. If we then move on to a second month, we can see that the number of cases in each has changed. And we've seen an increase in cases in District 4 to 5, and a decrease in District B to also have 5 cases. Now, if we were to assume that mobility, that the population has stayed the same over time, we would assume that that means that each of these 2 districts now has the same prevalence of the medical condition at 0.25. However, when we incorporate mobility data, we can see that the population of District A has increased by 5 people, and the population of District B has decreased by 5 people. As a result, the prevalence in District A has actually not changed and remains stable at 0.2. And while the prevalence in District B has reduced, it hasn't reduced as much as we originally thought, and the prevalence remains higher than in District A. So this is where mobility data comes into this information. It provides greater information and captures how the population changes over time. And what we have here is the ability to provide more frequent estimates of population based on detected temporary or permanent relocations of populations between different districts. And in the context of health metrics, this allows it to act as a dynamic denominator. So here, when calculating these metrics, we have cases acting as a numerator and the population acting as a denominator. And we're adding dynamism to that denominator to help us capture a more accurate picture of how the health of the population in each district is changing over time. This has a number of different applications across the health sector. So starting on the left, thinking about infectious and non-infectious disease. One of the main applications of this is for monitoring infectious disease and other diseases and measuring a more accurate picture of the incidence and prevalence, which are 2 important health metrics for any medical condition. And we can also estimate the population at risk of an outbreak using methodology that we'll discuss further in the next presentation. Thinking about vaccination, we can also use this methodology to better monitor vaccination rates and make better informed decisions about when the vaccination rate in an area might drop below a threshold necessary, for example, for herd immunity. It can also inform improved vaccination campaign planning by helping us better estimate how many doses might be required in a district to fully vaccinate the population. Finally, we can also look at infrastructure and resources and use our better understanding of how the population is changing to plan the location of new infrastructure and better improve the distribution of resources to reflect where demand has increased or decreased over time and how that demand might fluctuate on a seasonal basis. Excitingly, we can now share some preliminary results from some of this work. So looking first at outpatient department attendance in Oforokrom in Ashanti, we can see in the top panel the original static population estimate being used to calculate the number of outpatient department visits per 1,000 people between 2021 and 2022. And what we see here is no particular trend. We see large amounts of fluctuation, but there doesn't seem to be an increasing or decreasing trend. In the middle panel, however, we can see the percentage change in population based on CDR data between 2021 and 2022. And in relation to the static population baseline. And we can see here that there are some very large changes in the population in this area, likely associated with the university campus in this district. And when we incorporate this into a new metric for outpatient attendance, taking the change in population into account, we can see that there are quite large differences between the CDR-derived dynamic indicator and the static population version. And we can see some evidence that there may be an increasing trend over time, which may affect public health decision-making in this area. Looking quickly at a second example for tuberculosis incidence in the Accra metro area of Greater Accra. Again, at the top, we have the tuberculosis incidence from 2021 to 2022 when calculated using a static population estimate. And in the second panel, we can see the change in population of the district over the same time period relative to the baseline. And we can see here that there's an overall decline in the population based on the CDR data. What this means when we look at the two metrics compared to each other using the dynamic population estimate in blue and the static population estimate in gold is an increasing difference between the two indicators over time, with the static population estimate currently being used potentially underestimating the incidence of tuberculosis in this district, and that underestimation increasing over time as the population continues to decrease. In terms of our next steps, we have further health metrics and applications that we want to explore. As Victor mentioned earlier, we've also done some preliminary work on hypertension incidence, and our next steps will also be to look at antenatal care coverage and potentially pentavalent vaccination targets for districts across Ghana. We also have some improvements to our methodology that we want to implement, including our full new process for bias adjustment and population scaling of our population estimates. And this will allow more direct comparisons to the metrics calculated by Ghana Health Service. We're also continuing to assess the dissemination methods we're going to be using for this work, including understanding whether there are existing dashboards being used by the health sector which we can contribute to, and what format of output is most useful to the end users in the health sector in Ghana. I'll now hand back over to Victor to talk about the anticipated impact of this work.
Thank you very much, Tom. So looking at the impact of mobility data on public health, the project is expected to support policymakers and the Ministry of Health, whose responsibility is to develop policies to improve on the health system in the country. And this will depend on how best we correct the anomalies in the health metrics in terms of the numerator and the denominator that are used in this calculation. For more efficient use of resources in the health sector, there's a need for us to use this mobility data to ensure how best we can monitor and also respond to infectious diseases, which to a large extent will help us improve the public health system in the country. Moreover, vaccination campaign is great, but how do you determine a total coverage? Using mobility data will help us to support that and ensure that, yes, the health system is doing well when it comes to the vaccination coverage. Most importantly, improving the health of the people, where we say wealth is health, and with the use of mobility data, the public health sector and its system will ensure that, yes, the entire country is well, healthy, and it will help us to improve on the quality of health that we have. Thank you.
Thank you very much, Tom and Victor. Next, I'd like us to focus on how we can use CDRs for disaster management. This focuses on how data-driven insights can help in disaster management and preparedness. So I'd hand over back to Tom and Victor to tell us more about this use case.
Mobility data is very key, and its effects on disaster preparedness in Ghana is very, very important. In this presentation, we are looking at how we can incorporate mobility data into disaster preparedness in Ghana using the call detail records. Next. National Disaster Management Organization, that's NADBO, its core responsibility is to ensure that they manage disaster and emergencies such as flood, droughts, and other hazards that the country is exposed to due to its location in the sub-Saharan Africa. So we have sea, rivers, lakes, and any of its overflow have effects on the citizens. Hazards with analysis is essential because one, it supports the development of suitable responses for plans at risk areas and how best we can optimize the placement of resources. In terms of flood, how best can we mobilize resources to these emergency areas? Next. In calculating hourly risk hazards to support disaster preparedness in Ghana, there's a need to see how best different factors such as one, probability of areas being exposed based on the hazards and its impacts, number of people in the area that are exposed to the hazards, the vulnerability areas, which includes the socioeconomic vulnerability, and that of the vulnerable groups, which include one, women, persons with performing difficulties, and all as we terms disability. Capacity of authorities to prepare and also help these individuals of the population in where the hazards have impact is very key. Next. So in calculating the risk hazards, the different factors as been mentioned hinges on one, the impact of these hazards, the number of people in that particular area, more of the population of the people against the residents of the people in there. When it comes to the socioeconomic vulnerability, the business sector, those hardworking individuals and the impact of this hazard on them is very necessary, and there's a need for us to know how best we can use mobility data in calculating these risk factors. As I said, capacity of authorities and institutions is very key. And if NADMO as an institution to manage disaster does not have the capacity, then what can happen? It means that the effects will be very great. And institutions that need to respond to these hazards, if the capacities are not there, one of these institutions include the Ghana Ambulance Service, the district assemblies, which are the local authorities. Their role in this response to hazards is very key. Next slide, my colleague Tom will take us through. Over.
Thank you, Victor. So as Victor mentioned, these are the main factors that come into calculations when considering hazard risk analysis. But as we know from the mobility work that we've already seen, the population can change over time, and therefore the number of people exposed can change over time. So we can see that the population may decrease in an area, decreasing exposure and changing this analysis, or it may also increase as people move into an area and increases the number of people potentially exposed. So the work that we've done so far has been focused on flooding risk and calculating the dynamic hazard risk of flooding. The way that this works is that we're incorporating first anonymized CDR data and using this to calculate the percentage change in the number of subscribers present in each district in Ghana, comparing weekdays, Saturdays and Sundays, between 9 a.m., 1 p.m., and 6 p.m. And by combining this with static population data, we're able to create a dynamic population density for each district at these different times of day and different days of the week. We then combine this with hazard mapping data, which combines NADMO's calculations of the flooding risk at a 100-meter square resolution, which we then aggregate at a district level. And then we combine this with the population density at different times of day and different days of the week to calculate the dynamic hazard exposure. Finally, we add vulnerability mapping, again, aggregated at a district level into this, this figure to create our overall dynamic hazard risk for each district in Ghana, again, at different times of day and different days of the week. When we look at some of the results, on the left first, we have, for a series of districts, how the hazard risk changes at different times of day, depending on the day of the week. And what we can see is that in some of these districts, during a weekday, there are very large increases in the hazard risk as the number of people moving into the area increases the population density, peaking around 12 or 1 p.m. Particularly in this district in dark blue, we can see that the hazard risk doubles as you reach the middle of the day on a weekday, as people can travel into the area, presumably for work or to conduct business. When we look at Saturdays, we see a similar pattern, but less substantial than what we see on a weekday. And in comparison, on Sunday, we can see that the hazard risk in a district does not change much over the course of a day as people travel less into different areas. When we zoom into central Accra in particular, and again look at different days of the week and different times of day, starting with the weekday in the top row, we can see that there's a very large increase in hazard risk of flooding in the central business district, increasing by 9 a.m. and then peaking around about 1 in the afternoon, and then decreasing again as we reach the evening at 6 p.m. We can see a similar pattern on a Saturday, again with one particular area in the center of Accra experiencing an increase in hazard risk as people move into the area, but not to the extent that we see for weekdays. And then again on Sundays, we see very little change in hazard risk over the course of the day as people don't travel into the city centre in the way that they would on a weekday. So thinking about how we progress this further, we've had some really exciting conversations with NADMO when we were in Ghana in June. And this gave us the opportunity to work with them to review NADMO's hazard portfolio and understand what other hazards are they working with and which ones are well suited to CDR-derived dynamic indicators, and also understand what their priorities are. We were also assessing the different dissemination methods, again, thinking about whether there are existing dashboards or processes being used by NADMO that we can contribute to, and again, what are the formats of the outputs which are most impactful for our end users. And again, we have improvements to make to our methodology, including incorporating the long-term seasonal variations in people moving in and out of areas, for example, the impact of seasonal labour practices. We are also looking at implementing a new method for calculating subscriber presence. And we have work to do, again, implementing our new bias adjustment and population scaling of our indicators. And I'll hand back over to Victor again to talk a bit more about what we think the impact of this could potentially be.
Thank you very much, Tom. And looking at the results and some of the indicators that Tom talked about, we can see that mobility data can support NADMO to identify number of people and residents in a particular area. Then two, knowing the exposure level of these individuals, that's the people and the residents, will help NADMO to prepare how best they can assist victims in these areas. More efficient use of resources, especially in the allocation of the resources, is very key. And with the mobility data, NADMO can truly and efficiently use the resources. Also improving outcomes of the people in cities and how they have been affected by the disaster. There's a need for NADMO and its agencies that they work with stakeholders to improve on the responses of emergency services that they render to the victims and how best and rapid they can also give aid to these victims. Accessing aid by these victims is very key when they are in trouble, and mobility data will help NADMO to do that. Thank you very much.
Thank you.
Okay, thank you very much, Tom and Victor. Omar, I wanted to come back to you for a second to ask your thoughts about the use cases that have been presented, specifically from the perspective of the National Statistical Office and how you think it benefits all Ghanaians.
Yeah, thank you very much, Richard, and thank you, colleagues, for this wonderful presentation. I think this underscores the main purpose of this partnership. And given the presentation that we have heard from our colleagues, you can understand that COVID gave an important test case of what mobility data, CDRs, can be used for. And as Victor indicated, this obviously was one of the uses of CDR that we can be proud of as a National Statistical Office and National Statistical System, of having been able to contribute effectively to government decisions around COVID. Now, following this, then we work further with the partners to understand how much of this can be leveraged for other areas. While several areas have been identified, as we rightly saw, health and disaster management have been isolated for further work. And this, for me, underscores what all of us in Africa need. Why? Because the challenges are not peculiar to Ghana. They cut across all the entire continent. And our ability as national statistical offices to work beyond our traditional data systems to provide data that connects decision-making to solving the problems that our people are faced with every day. In this context, health and disaster management greatly enhances our usefulness and our relevance to the ordinary person. And so in that context, I think this is what the team has sought to demonstrate with the presentations that have been made. And so for me, this is very important, and it is important that we all look at it and see how we can together leverage this kind of a system to support our data systems in our individual countries, especially given that we have already done a lot. Many other countries who would want to travel this same path would not have to start from zero. They would have lessons to learn from us. They would have other partners who would see value based on what has been done in Ghana. And so we would want to encourage and urge all the other countries in the continent to think within this context how CDR can support the national statistical system. Thank you.
Thank you very much, Omar. We are almost at the Q&A session. I'd like to remind listeners that you can still share the questions that you have for the speakers in the chat section. And before we jump into that, I'd like to invite a speaker from each of the organizations to share concluding thoughts. Kapi, I'd like to start with you. Any final thoughts from Team Flowminder?
Yes, thanks, Richard. I mean, I think from today's session, it's really striking just how many applications there could be, from public health interventions and supporting disaster management through to innovative and new statistics that can be produced taking into account the dynamism of a population. And so I want to maybe reflect on how important it's been for Flowminder and Vodafone Ghana to be working with Ghana Statistical Service as the government partner that is the interlocutor with other ministries, departments, and agencies, or MDAs, within the government structure. That's been really powerful. They've been the convening power behind bringing together the different people that we saw in some of those photographs on the slides and bringing them to the table for thinking about use cases, thinking about how this data can be useful in the real world. And so that's been great. And so really thanks to Ghana Statistical Services for that. And I encourage other national statistical officers, as Omar said, to learn the lessons and be talking to Ghana Statistical Services about how this work has gone on. And then also on the other side, really important, I think, to reflect, you know, in COVID's times, what was really fortunate for us was that the data pipeline existed. And so the opportunity to invest in having such a data pipeline prior to a crisis occurring is really an important one. And that's the time to do it, not at the time of a crisis, because then it's actually a little bit more difficult. So having the opportunity to have a data pipeline in place for disaster preparedness, both in the case of what was being shared about how NADMO might use it, but also just more generally to be able to inform decision-making across the board when a large-scale crisis such as the pandemic hits, I think has been tremendous. And for that, I really want to thank Vodafone Ghana, because you had the foresight and the willingness to be part of this initiative, to really come to the table with your data. And of course, it's that data that underpins everything we're talking about here. So really just a thank you to all of the partners, as well as to all the really clever people we work with who presented here today. It's been really great, and I really hope we can expand to other parts of the African continent. We have a few other countries where we do work with, but Ghana is kind of special in its in the way that that partnership is structured and in the multiple applications we've managed to be able to demonstrate today. Thank you.
Thank you very much, Kathy. And now, Omar, any final thoughts from the team at Ghana Statistical Services?
Yes, Ghana Statistical Service is proud and happy to be a part of this partnership. And we see it as a groundbreaking partnership that, as I mentioned earlier, we would want to encourage our colleagues across the continent to think about. As our first president said during independence, that the liberation of Ghana, so the independence of Ghana is meaningless until it is linked to the total liberation of the continent of Africa. And so if the Ghana Statistical Service is the only one that does this, it does not actually give us what it takes to share and learn what we know and what we have done. And so for us, it is when we see many of our peers within the continent leveraging this kind of opportunity to strengthen their statistical system, where the national statistical offices, one would be seen as the go-to institutions for everything data to support the national development. That is what we would want to see. And it's not only for Ghana, but for the entire continent. Thank you very much.
Thank you very much, Omar. And a very big thank you to all our speakers today. And now I'd like to open the floor for the Q&A session. We've already received some questions, and so we'll start with those. Please feel free to share any other questions that you have while the speakers answer these ones. Right, so we'll start with the very first question, which is, I think Roman can answer that one for us. It says, do you have more precision at this point on how the analysis presented today will be disseminated? Example, the format of the results, the regularity, etc. Is it going to be regularly updated?
Yeah, thank you for the question. So I said previously, for the standard mobility side of things, we are trying to have this information coming out regularly. So I think for now we have settled on 6 months to 1 year regularity of the publication of this information. So I guess we are now providing already this historical period, as said, so this 2020 to 22 analysis. And then we want this to be constant. So having this digested analysis that is relevant. So it's still open for feedback and comments, I guess, along the way. And they is then made available publicly on a regular basis. Yes, I don't know if someone else wants to add something on this point.
Right. Thank you, Roman. Okay, let's take one of the very first questions from our viewers today. What is the market coverage of Vodafone in Ghana, and how does this influence the interpretation of your findings? Kathy, can you help us with this one?
I can try, and I'll be honest to say market share is not something I'm an expert in. I believe or understand that it's between 19 and 20% of the market in Ghana is Vodafone's. And that may be an out-of-date statistic, but the point that's being made in asking the question is really a really valuable and relevant one to our work, because what it points to is how representative is the data. And we are aware keenly of the need to make sure that we are addressing representativity in what we put forward. And as a result, we are actually planning a big initiative around bias adjustment and population scaling, which is terminology we are using to explain that we are going to use other data like field survey data, phone survey data, and even the census that we've obtained from Ghana Statistical Services, and in working in conjunction with them, we'll develop a model that will allow us to make adjustments to the data that we have. So at the moment, and what we've been presenting now has been unadjusted from the point of view that we're not necessarily able yet, because we haven't done all of the analysis, to bring that modification to the table, but we will be doing so. And I'd like to flag actually a plug for our next webinar, which is going to be exactly about this. We're going to be presenting the bias adjustment methodology and approach that we're taking, and we'll be very interested to have colleagues who want to know more about this at that one. Thank you.
Thank you, Kathy. Omar, I think you can help us with this next one. The question says, have you used the mobile phone data in a crisis context in Ghana, except for the lockdown or other coronavirus-related crisis?
Yeah, not really. We pray there are no many crises that comes our way. But this also underscores the fact that the infrastructure is set up to respond to such situations when we have them. Because once we had COVID and we could respond to that, what it means is that if we have another crisis that requires mobility data to help respond to that, we are ready to get in. And a typical example is, for instance, if there is an outbreak of disease and people begin to move from one location to the other, mobility analysis can easily be leveraged to help the health system to adequately mobilize and target their interventions. Thank you.
Thank you, Omar. Tom, there was a follow-up question to that, which was that what has been the most useful case, the most useful use case of the mobile data indicators for Ghana Statistical Service? That is, except for pandemic-related measurements. Can you help us with that?
Of course, thank you, Richard. So for both the disaster preparedness work and the public health metric applications, these are ongoing projects and we've not fully implemented them yet. But what we did see when we held workshops with NADMO and with the public health sector in Ghana back in June is the enthusiasm for potential uses of CDR data. I think that's a really strong indicator of what the impact of these could be when they are fully implemented.
Okay, thank you, Tom. Omar, I want to come back to you for the next one. And it's a really straightforward one. I don't know if the answer will be straightforward, but it says, how did you convince Vodafone to partner for this initiative?
We didn't have to convince Vodafone. Vodafone saw this as an opportunity for all of us to work together as as part of their social responsibility towards the country. And as I think it's something that in our case, it was not very difficult. But I can understand the question in the context that for another country that might want to travel this path, you would need to engage with the MNO. And I believe that is the main reason why we're having these platforms. Being able to share the lessons and the possibilities of how this data can support the national statistical system to adequately respond to national data needs in terms of disaster, or, for instance, the use cases that Victor and Romain and David spoke about on health and in disaster management. I believe that that may be an entry point of engaging with other MNOs. Thank you.
Thank you. Thank you, Omar. All right. The next question says, can you monitor this data users from abroad? Okay, can you monitor the data users from abroad that are using Vodafone network during their stay in Ghana? I'd like to ask Roman to attempt this one.
Yeah, thank you. So if I understand this correctly, meaning if we can flag if people being in Ghana come from abroad. And to be fully honest, I'm not totally sure actually, because this might be available in the data, but that's not something we've used, I think, at this point so far. I mean, to the best of my knowledge. So that's perhaps data that Vodafone has. I'm not totally sure if it's shared with us, but it's not a particular use case we've been looking into at this point. So I'll give a tentative possibly at this point, I guess, but I cannot say much more than that, I guess, at this point.
Okay. Roman, let me stay with you for a moment for the next one. This one says, was the code on these projects created collaboratively, or were the products created by Flowminder for GSS to implement on their CDR data?
Yeah. So I guess I'll start a little bit with this one, and I'll let also my GSS colleagues or trainees, perhaps I can say, also participate here. So was the code created collaboratively? Yes, in the sense that we've had a lot of interaction between each other through the years, really, because I think we started the training, I think it was last year, perhaps even before. So we've had a lot of training, on programming, data analysis, etc. And once we got to the point that we could communicate in the same language, we understood each other, then it was a lot of back and forth into how to make this analysis important and relevant, simply. What do we want to see from that, and what do we want to get out of it? So there is a lot more background to that, because generally, I mean, Flowminder would use his expertise to develop the actual methodologies. And there is also, a data pipeline that is in place that is like supporting this whole project. But I guess I'll give then the floor a little bit, perhaps to David and Victor, perhaps your perspective also on that, on this training and work we've had together.
Yeah. Hello. Yeah. So thank you, Romain and Richard. I think that we've come a long way. GSS staff, more than 6 staff have been trained in analysis of being able to access Vodafone data and also analyze it. Of course, capacity given to us is necessary, because once the standard mobility report has been developed and we start, generating report from, there will be the need for us in-house to be able to respond to emergencies. Like if there is crisis, as Omar said, we don't pray that happens. But if there is crisis anywhere and we need to respond quickly to that, there will be the need to go to, have a code that can really respond to that. So we've been given capacity in that respect, to be able to, as it were, write codes that can access, having access the data, analyze it, and then come out with some reports. Thank you.
Okay, thank you, David, Victor. No, David and Roman, actually.
All
right.
Just add, sorry, very quickly. So quick addendum to that. So the codes now is available to GSS. It's structured and it's automatically producing the data we need. So it's there, it exists.
Okay, thank you. Thank you for that clarification. Okay, we have a comment and a question from Sim. He says, always happy to see this great work from GSS/Flowminder. Thank you. And the question is, how are you now working with government users? Do you accept requests for reports and data products? How do you fit those into your project? So I'll ask Omar to answer, and maybe Kathy, you could add your voice to that.
Yeah, thank you very much, Richard. And I think that underscores the use cases that were presented today. We did not just start to work on these use cases. We have had to work with these institutions, the National Disaster Management Organization and the Ghana Health Service, to identify how we can potentially leverage the CDR to help their work. And so it's not like every government department comes up with the requests. And so you would need to look at where CDRs can best fit the work of that agency. Then you can work together, and it is a process. It's not like a one-off thing that they come up with a request today, tomorrow you have the results for them. You will have to work together to see how you fit it. And eventually, once you're able to develop it, then the data flow is something that will continuously be made available. Thank you.
Thank you very much, Omar. The next one is from Marcelo, and he says, thank you for the excellent presentations. In consideration of potential updates to population indicators, have you explored the possibility of updating the number of households or dwellings using call detail records? Tom, would you like to attend to this one?
Sure, thank you. So I think as Roman said about a previous question, this is not something that we've specifically explored or attempted. What I would say is that in theory, we could combine our CDR derived population estimates with survey data, which, for example, on the number of people per household, and from that we could, in theory, estimate number of households or number of dwellings from the CDR data. But this would require making, I think, a number of assumptions which may not be accurate. And I would suggest there's probably better ways of going about this using alternative forms of data. Satellite images or building footprint data, for example, would likely be better suited to making these estimates using big data sources. So in theory, I suspect we could, but I think that there are probably more promising approaches.
Thank you very much, Tom. And while I have you, let me direct the last question, I think, to you. How do you engage with the relevant partners such as NADMO or Ghana Health Service throughout the process?
Yeah, so this is core to so much that happens in this partnership. And really, GSS are the key link between Flowminder and all the other ministries, departments, and agencies in the government. We've engaged with both NADMO and GHS in a number of ways. Perhaps most significantly, earlier this summer, as we mentioned, in June, we had a 2-day workshop with staff from GHS and the Ministry of Health and also the University of Ghana, and a second half-day high-level workshop with the health sector in Ghana as well. And we had a separate 1-day workshop with NADMO. And both these consultations were hugely effective at allowing us to engage with the end users and potential end users of our work and better understand what their requirements are and what their priorities are. And since then, we've been trying to maintain some of these channels of communication and trying to maintain some regular engagements and discussions to get feedback on our work and understand whether or not what we're doing is going to be effective and useful for our end users down the line. Perhaps I can hand over to Victor, though, to give his perspective as well on this.
Thank you very much, Tom, and apologies for a problem with my camera. So we have been engaging this institution, Ghana Health Service, and that of NADMO. Before we will develop a use case, we have a discussion and series of meetings with them for us to get their input into the use cases that we intend to develop, because they supervises where or have data on where disaster have happened and where signals indicate. Thank you.
Thank you very much. And I'd like to say a very big thank you to all of our speakers. That was the last question, so we are wrapping up. I'd like to thank everybody who's been involved on the project, GSS, Vodafone Ghana, Flowminder, and also to remind our attendees that the first webinar is available online on Flowminder's YouTube, so you can check it out there. Please watch it, like it, comment, and most especially share. And contact Flowminder directly if you want to discuss anything further, collaborations, etc. So thank you all again very much. Stay safe, and please be on the lookout on our social media channels for the next webinar. Thank you very much again, and bye-bye.